Save Missouri Moms. In 2016, 24 pregnant or new Missouri moms died. In 2018, it's expected to be 33 deaths. Missouri's maternal mortality rate is higher than the United States rate at 32.6 per 100,000. Missouri ranks 42 in the United States for maternal mortality, this making it one of the most deadly states in the United States for childbearing women. There has been a 14% increase in maternal mortality over the last 2 years in Missouri. This is partially attributed to lack of access to obstetric health care, as depicted in this map, where the majority of counties in Missouri have less than 2 hospital beds dedicated to obstetric patients. The story of the Brashacker family, reported by the Kansas City Star newspaper, gives an example of what is happening in Missouri. In May of 2017, Jen, a mother of 3, started premature labor. She was put on medications to prevent labor from continuing and give her daughter more time to grow. After medication change, she suddenly developed a very intense headache and was in intense pain. It took minutes before she was unresponsive, and her husband called an ambulance. While Jen's baby was delivered and saved, Jen suffered a massive brain hemorrhage and died. Now left to raise those 4 children alone. Another example of the devastating effects of maternal illness and death are demonstrated by this news story.
Tara Hansen was 29, active, and on top of the world about her first child, Brandon. Hi, Brandy Bear. But within hours of giving birth, she didn't feel well. She told her husband, Ryan, and medical staff. Did she tell doctors?
She did. We just were never able to kind of push the needle to the point where somebody said we need to do more.
6 days later, Tara died of an infection.
It's very hard to understand.
It's an alarming trend. The U.S. has the worst maternal mortality rate in the developed world. At least 700 women die every year from pregnancy or childbirth. Some 65,000 nearly die. Serena Williams says she was almost a statistic. After giving birth, the tennis star was diagnosed with blood clots, but only after she repeatedly insisted doctors do a CT scan. African Americans are particularly at risk.
We're significantly behind other advanced nations, and we're really not sure of the reason why.
What can be done to save Missouri moms? The creation of maternal mortality review boards have been effective in improving maternal death rates. Maternal mortality review boards identify trends and causes of maternal deaths and what contributes to those deaths. They bring together healthcare experts to study the deaths, make recommendations and action plans for safer maternity care. They institute toolkits and protocols to address the specific issues. Maternal mortality review boards save lives through quality improvement in healthcare. In 2018, Congresswoman Sarah Unsicker introduced a bill intended to establish an effective maternal mortality review board in Missouri. This was to create accountability for maternal deaths in Missouri and to require a review of all of those deaths. They were to make recommendations for healthcare changes to prevent future deaths in Missouri. After debate, the House of Representatives voted down the proposal 49 to 78. Congresswoman Unsicker will introduce the Maternal Mortality Review Board bill in the next session. Strong national support exists for maternal mortality review boards, including the following organization as listed: the American College of Nurse Midwives and the American College of Obstetrician and Gynecologists are in full support of the establishment of maternal mortality review boards in each state. What can you do to save Missouri moms? Contact your legislator and demand that they help support legislation regarding maternal mortality review boards. The way to contact your Missouri legislators is here on the slide. Both representatives and senators. Also included on this slide are other federal bills on maternal mortality. Another way you can get involved for advocacy for mothers in Missouri are organizations such as March for Moms, Every Mother Counts, For Cura for Moms, and Work for Mothers. Take action now. help save the lives of Missouri moms, and help Missouri be the healthiest state in the nation for childbearing women.